everybody, welcome to Beyond the Treatment Table Chat number 4. We're racing through them this week. These 10 days are really speeding past. Peta Crogan, I'd also like to welcome you all the way from Western Australia. Welcome to our Beyond the Treatment Table Chat today.
Oh, thanks, Loretta. It's really exciting to be here.
It's wonderful to have you here. Now, Peter is coming to us today as an Ayurvedic practitioner and also an instructor in the McLaughlin Scar Tissue Release Protocol. I'll pop that word on the end there. And when I was thinking about who else we could have as part of these Beyond the Treatment Table Chats, Peter, I said to you when we first met, so many of our Bowen therapists are working with people who have scars and are very excited about the work that you do and many people have started doing the training. So I thought, well, let's have a conversation about scar work and what the impact can be. So welcome, Peter, as I said, Ayurvedic practitioner, scar work. How do these go together? How did you get involved in this to begin with?
They go together beautifully because we all have a body.
Okay.
Right? The Ayurveda is about book of longevity, book of knowledge about life. But what I would say is that I came into this quite by accident. I was having a treatment for my left shoulder. It was sitting forward. Oh, and I've got flowers on my shoulder.
That's a nice way to have them.
Forward, and I went to see my favourite Bowen instructor, Bowen practitioner, who was working on my body, and she does a lot of other techniques as well. And having flipped me over a couple of times on the table, I know you'll all know what that means, she still couldn't get this shoulder to lay flat on the table. At that point, she noticed this little scar, and I don't know if you can see it on my bicep here. It's very faint now, but at the time it was quite red and puffy. This is a scar from a melanoma being removed years ago. And she said, look, I've noticed this scar on your arm. I do another technique on scars. Are you happy for me to work on this scar? It meant nothing to me. Yeah, sure, go ahead, of course. And I'm getting goosebumps just thinking about the experience now, because next thing I knew, my practitioner was gently touching on my skin. It felt very, very light. Nothing was really happening, but all of a sudden I had a well of emotion. And I said to her, look, am I crying? And it was like little sprinklers had started. I was laying there crying, and I was rationalizing the crying, going, well, you're working on the lung meridian. Well, that's related to grief. Perhaps there's something there. You're working on this. And then the memory came up, which was associated with my scar. So this is one of the most profound and gorgeous things that happens with scar tissue release, is that those memories can actually be opened and released. But my memory was that my son was 2 at the time of that little melanoma being removed, and I didn't know if I was going to see him grow up.
Wow.
So a couple of minutes of treatment. The longest part of that treatment was the practitioner, Laura, giving me a minute to have a little cry and use a tissue. That was the longest part of the treatment. And then she reassessed my body, and my shoulder was sitting flat. So there was a connection between this little scar pulling my shoulder forward in the joint. I just was blown away. When I went home, my son, who I didn't think I was going to see grow up, he was 17 at the time, and I showed him my scar, and he said, just like boys of that age, what the F, Mum? Did you go and get some, what did he say? Did you go and get some plastic surgery? What's happened to your scar? So the scar had reduced in colour, reduced in appearance, reduced in puffiness, and also had reduced in the sensitivity that I feel when I stroke my own hand across that scar, as well as that little emotional release that had happened. I was blown away. I had to learn the technique, and I signed up to the very next class. And then just like that experience, I've had similar experiences with all of my clients. So in massage, I do a lot of, in Ayurveda, I should say, I also offer Ayurvedic massage. And I do have clients coming back with the same problem, coming back again and again and again. And even, those shoulders that you come across that you can't release, they're just locked or knots that never seemed to release. And I was frustrated with that, because an Ayurvedic massage is actually more about the application of oil than the remedial work. But when I learnt scar tissue release, I could apply that technique to those hardened areas of muscle as well. And I was finding we weren't getting the recurrence of the problem as much. So multiple benefits there. And with the results I was seeing, when the opportunity came, was put out to all the practitioners to apply for being an instructor, I was one of the first to put my hand up, and absolutely loved teaching this technique and watching the aha moments in my students' eyes during the day when they get results on the very first day. It's pretty cool.
So, Peter, when you say to people at a barbecue that you are an MSTR instructor, and they say, "What's that?" What's your, in a nutshell, explanation for what this therapy is?
Right. Yeah. So I usually use my hands, and I invite you to do this now, just as I'm talking about it. When we're formed, when we're made as babies, we're made very linearly and neatly, like the muscle fibers. And I'm sure you all know this from your anatomy training. The muscle fibers all have long linear lines, and we have our circular joints, and everything's very neat. And then we have an injury. So that tissue is torn or ripped or damaged somehow. And if we're thinking fascia and muscle tissue, just as an example, then we get an area of adhesion. So if you just loosely link your hands and do a bit of a Michael Jackson, and then imagine that we've had an injury, we've had a scar, and suddenly we've got some contracted tissue. So contract, tangle up your fingers maybe and contract that, and try again to do that Michael Jackson action. It just doesn't happen. So what I'm doing in scar tissue release is a simple little hands-on technique that is opening up those gaps. I'm not realigning the fibers or anything like that, but I'm creating a little bit of space between all of those fibers that have been laid down, which enables blood flow, nerve signaling, and lymph flow to be reestablished if they're able to be reestablished. And in saying that, I just mean, for instance, if a nerve has been severed, we can't reestablish that. But if a nerve has been compressed, we can reestablish the signals. Does that make sense?
Well, I'll ask the assembled crowd. Can I have a nod if that makes sense? Yes, they're nodding beautifully. Excellent. You've passed the barbecue test. Because that's often the thing, isn't it? People want to know, well, what are you going to do? And for people who may be a Bowen therapist and are also trained in this, and they may be suggesting to their client, well, I might try this new technique. I might try something different with you. Peter, I think I know the answer to this, but I'm going to ask the naive question anyway. Are all scars the same?
Oh, of course not. But there are no silly questions, right?
So if they're not all the same, what do we know about them?
Well, in the training workshop, we talk about different scars, as in the scars that we see on the surface, like my arm, the scars that we see on the skin. We talk about the keloid scar, hypertrophic scar, atrophic scar, contractures, burns scars. They're all slightly different, but we do apply the same technique to them all. There's a little side note about a keloid scar, because that has an autoimmune and inflammatory process involved. So we treat them with a little more caution, and we teach about how to approach that in our training. But also inside the body, we have scarring happening as well. And that might be, like I said before, a muscle tear, or if you consider laparoscopic surgery, where an instrument is protruding into the body and moving around and pushing around the organs in the gut. Nothing inside of our body likes to be touched. I'm sure as Bowen therapists, you all know how nerves don't like to be touched, right? And then if we think about at the very next layer, going even deeper, the fascia layer, when the fascia is touched, it acts a bit like a spider web, in that those fibers can break, but then they might stick to each other, and we end up with this domino glue kind of effect. So we can open up some of the fascia as well with the scar tissue release, and we can open up those muscle tears. Basically, we're opening up anything where there's been a fibrin input in the healing process, we can soften that tissue and help that tissue to function better.
And so, Peter, you're really talking about, you know, the physical impact of the scar and the physical nature of what you can do to support that change. But there's also an emotional element, and you sort of touched on it really lightly to begin with.
Yeah.
When people come with you know, their complexness to, you know, someone's treatment room, what do we need to know about the emotional side of scars?
There's deep layering. There can be a lot involved in a scar, and I just invite you to think about the difference between a scratch on your arm and a gunshot wound. There's a very different incidence which has led to the damage and the healing process in the body. Now, in Ayurveda, it's really interesting that the word for muscle, the Sanskrit word for muscle, is mamsa, and it translates to memory. So the body's actually designed to catalogue everything that happens to us and remember that in our tissues. So we have a memory of sorts in our tissues. So we do advise our students very strongly to approach with care. And one of the big stipulations we make about scar tissue release is that you never jump straight in. If you're treating someone doing a massage, I could work on a knot in their back, for instance, while doing a massage, yes. But if I notice a scar on the surface, some sort of trauma has happened that has created that scar. Even this exists with many of the tears inside the body, but definitely any scar that you see on the surface, you need to approach the individual and let them know you see a scar, you think it might be impacting on their treatment, and get permission to touch that scar before proceeding. Even just taking that back to the very basics of touching a scar, think about the different sensitivity there as compared to other areas. It's a very intimate touch when you go directly with your fingerprints, you know, fingertips straight onto a scar. So we definitely spend a lot of time talking about emotions and caring for the individual and how to work through that. In saying all of that, the beauty of MSTR is that we don't have to spend weeks and weeks untangling this scar and the trauma around it. If we have full permission from the client and the client has an emotional release, usually that's done and dusted. And the connection is not, the connection is still there, the memory is still there, but that emotional trauma is somehow dissolved as the tissues release it. It's quite beautiful.
And so what you're saying in most cases that there doesn't tend to need to be further support or therapy, emotional therapy potentially in that release?
Not necessarily. What I'm saying is that as a practitioner, we work within our scope of body work. First and foremost, you will sometimes have clients who are already in counselling for the trauma that caused the scar or issues around that trauma. You know, it could be a C-section that, you know, something happened to the baby or the mum was very traumatized. It could be something as simple and common, not simple, but common as that. Or it could be, like I said, a gunshot wound. Those clients may be already seeking, you know, counselling or psychotherapy. However, what I'm trying to say is that we as practitioners don't go delving into the story, and there's no need for us to go delving into the story. We hold space for the individual. We let them have a cry. We take a minute to take some notes. We give them a glass of water. If they're ready to continue with treatment, we can come back and continue with treatment. As far as ongoing support, if any of my clients have an emotional response, I will advise them to take it easy that afternoon and usually give them a call or send them a text, or at the very least give them my number if they need to have a chat later. So, you know, that ongoing contact is our support, but we don't need to be unraveling the story.
I think it's such an important point to make. And I think sometimes that fear of the unknown of the release that might happen might also maybe keep some therapists from maybe potentially offering that treatment. And I know on today's call we're going to have people who are new to this work. Some people who've maybe done the training but haven't had a lot of experience, and I'm sure there's some people, and I might get a show of hands, who actually work quite extensively in this. But I wonder, Peter, if I can just get maybe some words of wisdom for those people who maybe have done the training or they're partway through or they haven't really confidently step forward with it. Maybe they've done a couple of treatments, but not many. What would you say to those people who are at that stage of their learning and their exploration with this?
Well, one of the beautiful things I love about this training is that the instigator, Alistair McLaughlin, who was a remedial masseuse and Bowen practitioner and instructor, and lived in Australia for a while, he developed this technique, but he has fostered a group of such fantastic support that and I get goosebumps thinking about it, that there is always somebody available to support you if you need to reach out. So we have a closed group for students and practitioners where practitioners and students are sharing their case studies and their results, and anyone who is a student can go in there and ask a question or use the search function. Myself and the other Western Australian practitioner, Jane, we're available to chat and review. But, taking it back from there, I would say that first and foremost, trust your training. And I still doubt myself sometimes. I'll be doing some work and thinking, I don't know if they're feeling anything. And the client will be amazed at the changes in their body when they get up off the table. So trust in your technique, and it's a case of less is more. This is a very light technique. We use pressures, which we use a maximum pressure of 5 out of 10, and we talk about 8 to 9 out of 10 being the standard remedial masseuse kind of pressure. It's a very light pressure, and so we would say come back to lighter pressures and trust your technique. Make sure your technique is correct. Slow down, take notes, take photos. We usually find if someone's not getting results, there's something not happening with the technique.
Okay.
Yeah.
And so it is a modality you can learn online?
Yeah, we have a short class, a small class training, which is online, and that's a 3-hour training. So that fits in a lot better with a lot of people who are working. And we've actually got a December 9th class, which is booked out already. And because we were booked and had a wait list, we've opened up a December 10th class. So that's December 10 this year. We're doing a 3-hour online class. If there is anyone in Perth, we've got an in-person class in Perth on the 12th of November. And yeah, we love our training online. It's a little tricky to see what people are doing in the prac, and that's partly why we're now doing a shorter class, but we can still offer video messaging with Facebook or little Zoom calls like this should we need to. But we find that most people get a result once they've practiced the technique on the first day, and they're confident then to start experimenting on friends and family and themselves.
Fantastic. And Peter, it's how long has this technique been around? I know I might really be testing you here.
You are testing me. I've got a few notes on the side here about Alistair, and I'm just double checking if I'd written that in. I think he started using the training I think he started playing with it in about 2007, but I don't have those notes in front of me. But I know he's definitely been teaching it, for about at least since 2019, when I can definitely say the technique grew in popularity because Alistair commissioned a study, an ultrasound study. And I'm going a little off topic there.
That's okay.
Can I share that?
Yeah. Sure.
So he commissioned a study and employed an ultrasonographer to measure vascularity in C-section scars before and after treatment, and showed repeatable what is it that we say about results? They have to be repeatable and someone else can do it.
Yes.
So after one treatment, so basically before treatment, there was a big shadow that could be seen on ultrasound inside the scar where there was very little vascularity. After one treatment, so one pass of about 15 minutes across the C-section scar, ultrasound was applied again immediately, and there was an improvement. So that big black shadow of low vascularity had reduced very much and had reduced in depth as well. And the ultrasonographer said, he actually said, there's now vascularity in the scar, which I would be careful about that terminology. I would say there's improved blood flow through the scar, because he was almost implying that new blood vessels grew immediately. But yeah, improved vascularity could be seen through the scar immediately after one treatment. And yeah, that study is available on the MSTR website if people want to take a look.
Fantastic. And we can add the link to the website in our notes. We've had a number of people who have joined fairly late into the conversation. So I'm just going to ask you one more question, if that's okay with everyone. Just go a few minutes longer. Who do you mostly see? I know this treatment can help everybody, but who is it that you see that you get really great results with, or their life is really improved, or that because of the work that you do with them? Is there a cluster of people?
There are a couple of clusters. Joint replacements, so knee and hip replacements, especially in the hip. I've had a couple of clients come to me, and that the tissue in the buttock underneath the long, beautiful linear scar, but it goes all the way into the hip joint, the tissue underneath that is compacted and hard and doesn't move. So that means that entire glute doesn't function properly. The glute medius isn't able to contract, so the lower back is not supported. So we've got all these distal effects happening. By loosening and opening up that tissue, those clients have had fantastic improvement in their lower back pain. And then huge results in any breast surgery, especially the reconstructions. Some of them that I've seen are horrific, the mess that has been made of that poor woman's body, and just to release the aberrant tensions that are going on in her chest and back and underarm, that's huge. And especially range of motion in the arm. You know, one of my breast clients couldn't get, when laying back on the table, she needed 4 towels folded triple ways. So it was, you know, a foot worth of towel to hold her arm in a comfortable position so I could work through her armpit. And after scar tissue release, one of the towels fell off. So I was just readjusting all the towels, and she did a bit of a stretch and her arm went flat on the table. And she was kind of going, oh my goodness, you know. Of course, she jumped off the table and hugged me in her bras and knickers. She was so excited. But yeah, our joint replacements, big surgeries like breast surgery and C-section scars, big changes.
Fantastic. I'm just going to change the view that I can see everyone and everyone else will see. We've got some lots of different faces on the screen. Can I get a show of hands? Who is currently using this technique? Wendy is. Who is very interested, but they haven't quite gotten along to learn about it yet? Yeah, okay. Peter, you might need to run a few more courses. Just saying. Wendy, can I put you on the spot? Are you able to unmute yourself? Wendy, can I just ask what your experience has been with the technique?
Again, I've done a lot of C-sections, a lot of women who come to me with Bowen for back pain. And then when I've done the C-section, it just eases back pain that they've had for years and years and that they've had to keep coming back for. Another group of people that I do is thyroid scars, people that have had thyroidectomies, and there's a big emotional component with that. Some really strong results with that. Breast tissue as well, and joint replacements as well. So I love the technique. I would encourage every Bowen therapist to learn it. It's fabulous. Yeah,
and it's so simple to do, isn't it, when you get your head around all the directions, right? Wendy?
Yep, definitely. The only trouble I have, like I often I don't know sometimes, should I do it alone or should I do it in a Bowen treatment? Because often I will do it alone when I've discovered that there's a significant scar, but sometimes if it's a little one, I will put it into the treatment as well. So, you know, and it works. So I don't know, is that correct or not correct? Are you better to do it alone? But yeah, it works.
Well, we certainly encourage our students to do the treatment alone so that they can measure their results.
Exactly, in the case studies. Yeah.
Yeah. And I can see I'm getting lots of questions there, so I'm happy to answer them in a minute. But like my own story, my little scar was treated in the course of a Bowen treatment because it was discovered in that discovery process. So we may not always, and often the individual won't even tell us that they have a scar because they're not connecting the scar to the symptoms that they're having, but also many people are disconnected from their scar. So that's a hidden, something that's been suppressed and hidden in themselves. So both ways, Wendy, I like the way that if you know it's a significant scar, you separate it out. And the main reason we do that is to allow space for that emotional release if it happens.
Yes.
Because if we do that and we're halfway through a Bowen treatment and want to be finishing off, it's often too much for the individual. We usually need to stop after that emotional release.
Yeah. Thank you so much, and thank you for letting me put you on the spot there, Wendy. Just one of the questions that did come through from Phil was, is there a prerequisite for the training, Peta?
Basically, we need our students to have some anatomy and physiology training. So I went in as an Ayurveda practitioner and was a scientist in my previous life. We do have many Bowen therapists and many remedial therapists. They're probably our primary groups. But physios, chiros, Jane says to be careful what I ask for. I'd love to teach some surgeons or the surgeon support teams. I think that would change the face of surgery as well. But definitely in that recovery time. But yeah, you'd all have, as Bowen practitioners, I'm sure you'd all be more than qualified.
Fantastic. Michelle Turner said that she's enrolled on the 9th and can't wait. And Natalie said she's sold and wants to do the course.
Fantastic.
Peta, thank you for going over time. I really appreciate that. I think that that was really worthwhile. And I'm sure everyone has really thoroughly enjoyed that. Thank you so much, Peta. Thanks for being with us.
It's my pleasure and lovely to meet you all. I hope to meet you in person soon.